The following portion of Daytime Blue Ridge is sponsored by
If you suffer from back pain or have a sports injury that prevents you from living the life that you want to live, you don't have to live that way. Dr. Ethan Colliver is a trained sports and spine care specialist from Valley Sports and Spine, and today he's joining me to talk about osteoporosis. Thank you so much for coming in.
Thank you for having me.
So I hear the term osteoporosis all the time, but I have no idea what it is.
Okay, so in short, it's thin bones or low bone density. It's the most common metabolic bone disease in the world. It affects about 10 million Americans.
Oh, wow.
It's usually a silent disease, but the problem is that you can start to develop fractures.
Okay.
And so there are 2 million fractures related to osteoporosis in the United States on a yearly basis. And fully 1/4 of those occur in the spine, which cause a lot of pain, can lead to worsening posture, which can actually lead to further falling and further fractures. Okay. One of the most sobering statistics to remember, though, is that in the population over 65 years of age, once you get your first spinal compression fracture, there's a 90% chance that you'll be dead in 7 years.
Wow. Now, who's affected by this? Because you said millions.
Yeah. Women get it more than men, but
Okay.
about 21% of patients are men. Certain populations get it too. So, for example, white women and Asian women get it much more frequently than African American women.
Okay, so if somebody might feel like they should go see you, what are some signs that people probably should go to a doctor?
Okay, so if you're talking about treatment, again, it's silent. So we really need to think about it even in our young people. So for example, you get your peak bone density about 18 to 20 years of age. So we want to make sure that our kids are getting calcium and vitamin D and also regular exercise.
Okay.
Once you get postmenopausal, a woman should be on a calcium and vitamin D supplement as well as get a bone density scan.
Okay.
Once you're diagnosed with osteoporosis or you get a fracture, you need to be on medications that decrease your risk of fractures. A fracture can be very painful, so your doctor might put you on some pain medication, even a back brace.
Okay.
There's also a procedure where you can inject cement into the fracture. That can help restore the height of the bone, and it can decrease pain from the fracture.
Okay.
Lastly, we know that medications help decrease fractures, but exercise can be just as effective as the best medication.
Great.
So oftentimes we combine it. Dave is actually going to show us.
Yeah, so we have Dave over here, so we'll walk on over to Dave. So you're going to show us a few exercises, is that right? And are you with Valley Sports and Spine as well? I'll stand in the middle of you.
Valley Active, we're just an associated rehab studio there.
Great, so you have your table here. So show us a few exercises that might help, and you can walk us through.
Yeah, absolutely, great, thanks. So the first thing to remember is not all exercises are created equal when it comes to exercising for osteoporosis. Mainly, you want to avoid exercises where you go into spinal flexion or your back rounds out.
Okay.
Okay, that can actually increase your chance of a fracture. The exercises you do want to do are exercises that use extension, okay? And so the exercise I'm going to show you today is an extension exercise, and it can significantly decrease your risk for a fracture.
Okay.
So you're going to start laying facing down. You want your head to be neutral, arms down at your sides, palms facing down. You're just going to gently raise your head and shoulders off the table.
Okay.
Pause, slowly lower back down, and repeat.
Okay. That's it. I feel like, I think I've done this before, and I can feel it in my back when I do that, in my lower back.
Absolutely.
And it tends to actually help me. So, great advice. This is something that somebody can actually do at their house.
Yes.
Now, if somebody wants to find more information, maybe they feel like they should see a doctor,
Yeah.
how can they get a hold of you?
Yeah, so we're on Facebook.
Okay.
We also have a website, valleyactive.com, as well as valleysportsandspine.com.
Thank you so much for coming in. Now, if you at home want a recap of this segment, you want to see the exercise again, or if you want a link to their information, we will have it on our website. Just go to daytimeblueridge.com. We'll be right back. Thank you so much.